The forearm muscles are essential for wrist, hand, and finger movements. They are divided into the anterior and posterior compartments. The anterior compartment contains flexors and pronators, mostly innervated by the median and ulnar nerves. The posterior compartment contains extensors and supinators innervated by the radial nerve. A simple way to name and identify forearm muscles is to break them down into three key components: their functions, locations, and structures. Based on their functions, a flexor bends the wrist or fingers. An extensor straightens the wrist or fingers. A pronator rotates the forearm to face anteriorly. A supinator rotates the forearm to face posteriorly. An abductor moves a digit away from the midline. Based on their locations, muscles which are carpi act on the wrist. Digitorum acts on the fingers. Pollicis act on the thumb, also known as pollex. Indices act on the index finger. Ulnaris are positioned closer to the ulna or the medial side of the forearm. Radialis are positioned closer to the radius or the lateral side of the forearm. Based on structure, depth, or special features, a superficialis is more superficial in the forearm, while a profundus lies deeper in the forearm. A longus is a longer muscle, while a brevis is a shorter muscle. For example, flexor carpi radialis means a muscle that flexes the wrist and is located towards the radius. Similarly, extensor pollicis longus means an extensor of the thumb that is long. In the anterior compartment, the superficial muscles include the pronator teres, which originates from 2 points. The humeral head originates from the medial epicondyle of the humerus. The ulnar head originates from the coronoid process of the ulna. It inserts into the lateral surface of the midshaft of the radius. It pronates and flexes the forearm. The flexor carpi radialis originates from the medial epicondyle of the humerus. It inserts into the base of the second and third metacarpals. It flexes and abducts the wrist. The palmaris longus originates from the medial epicondyle of the humerus. It inserts into the palmar aponeurosis and flexor retinaculum. It tenses the palmar fascia and assists with wrist flexion. The flexor carpi ulnaris originates from the medial epicondyle and olecranon of the ulna. It inserts into the pisiform, the hook of Hamet, and the base of fifth metacarpal. It flexes and adducts the wrist. The flexor digitorum superficialis has 2 heads. The humeroulnar head originates from the medial epicondyle and coronoid process of the ulna, while the radial head originates from the anterior radius. It inserts into the middle phalanges of the second to the fifth finger. It flexes the proximal interphalangeal joints and the wrist. The muscles in the deep layer of the anterior compartment include the flexor digitorum profundus, which originates from the anterior and medial surface of the ulna and the interosseous membrane. It inserts into the distal phalanges of the second to the fifth fingers. It flexes the distal interphalangeal joint and assists with wrist flexion. The flexor pollicis longus originates from the anterior radius and the interosseous membrane. It inserts into the base of the distal phalanx of the thumb. It flexes the thumb. The pronator quadrators originate from the distal anterior surface of the ulna and insert into the distal anterior surface of radius. It pronates the forearm. All the muscles in the anterior compartment are innervated by the median nerve, except the flexor carpi ulnaris, which is innervated by the ulnar nerve. The flexor digitorum profundus has dual innervation from the median nerve and the ulnar nerve. In the posterior compartment, the muscles can also be divided into the superficial layer and the deep layer. In the superficial layer, there is the brachioradialis, which is actually a flexor muscle in the extensor compartment. It originates from the lateral supracondylar ridge of the humerus and inserts into the styloid process of the radius. It flexes the elbow, especially in mid-pronation. The extensor carpi radialis longus originates from the lateral supracondylar ridge of the humerus. It inserts into the base of the second metacarpal. It extends and abducts the wrist. The extensor carpi radialis brevis originates from the lateral epicondyle of the humerus. It inserts into the base of third metacarpal. It also extends and abducts the wrist. The extensor digitorum originates from the lateral epicondyle of the humerus. It inserts into the extensor expansion of the second to the fifth digit. It extends the fingers and the wrist. The extensor digiti minimum originates from the lateral epicondyle of the humerus. It inserts into the extensor expansion of the fifth digit and it extends the little finger. The extensor carpi ulnaris muscle originates from the lateral epicondyle of the humerus and the posterior surface of the ulna. It inserts into the base of the fifth metacarpal. It extends and adducts the wrist. In the deep layer of the muscles of the posterior compartment, there is the supinator muscle, which originates from the lateral epicondyle, the radial collateral, and the annular ligaments. It inserts into the proximal third of the radius, and its action is to supinate the forearm. The abductor pollicis longus originates from the posterior ulna, the radius, and the interosseous membrane. It inserts into the base of the first metacarpal. It abducts and extends the thumb. The extensor pollicis brevis originates from the posterior radius and the interosseous membrane. It inserts into the base of the proximal phalanx of the thumb, and its action is to extend the thumb. The extensor pollicis longus originates from the posterior ulna at the interosseous membrane. It inserts into the base of the distal phalanx of the thumb. Its action is to extend the thumb. The extensor indicis originates from the posterior ulna and the interosseous membrane. It inserts into the extensor expansion of the index finger. It extends the index finger. All the muscles in the posterior compartment are innervated by the radial nerve. Overuse of the muscles in the flexor compartment and the lateral compartment can cause epicondylitis. Since the flexor tendons originate from the medial epicondyles, overuse of the flexor tendons can cause medial epicondylitis, a condition known as golfer's elbow. While excessive strain on the extensors can lead to lateral epicondylitis, also called tennis elbow. To summarize, the forearm is divided into flexors and extensors with key functions in wrist and finger movement. Understanding their origins, insertions, and innervations is crucial for both medical examinations and clinical practice.